Causes of eczema and its treatment. Eczema, also known as atopic dermatitis, is a common skin condition that causes inflammation, itching, and sometimes a rash. Its exact cause is not well understood, but it is believed to be a combination of genetic and environmental factors. Here I told you about some of the potential causes and factors that contribute to eczema. Genetics. Eczema tends to run in families. If you have a family history of eczema, asthma, or hay fever, you may be at a higher risk of developing eczema. Eczema's tendency to run in families suggests a strong genetic component in its development. If one or both parents have a history of eczema, asthma, or hay fever, their children are more likely to inherit a genetic predisposition that makes them susceptible to eczema. While genetic factors play a significant role, environmental influences can still exacerbate or trigger the condition, making it a complex interplay between one's inherited genetic traits and external factors. Immune system dysfunction. Eczema is often associated with an overactive immune response to triggers like irritants and allergens. The immune system may react by causing inflammation in the skin. Immune system dysfunction is a key component of eczema or atopic dermatitis. In individuals with eczema, the immune system often reacts excessively to triggers, such as irritants and allergens, leading to inflammation in the skin. This overactive immune response results in the hallmark symptoms of eczema, including redness, itching, and the development of a rash. Additionally, people with eczema tend to have a compromised skin barrier, which makes it easier for irritants and allergens to penetrate the skin, further exacerbating the immune system's response. Understanding this immune system dysfunction is crucial in developing effective treatments for eczema that focus on reducing inflammation and restoring the skin's barrier function. Environmental factors. Certain environmental factors can trigger or exacerbate eczema, including exposure to harsh soaps, detergents, fragrances, extreme temperatures, and low humidity. Environmental factors play a significant role in the development and exacerbation of eczema. Exposure to various environmental triggers can lead to flare-ups and worsen the condition. Harsh soaps, detergents, fragrances, and extreme temperatures can irritate the skin and contribute to eczema symptoms. Low humidity levels can dry out the skin, making it more prone to irritation and inflammation. Moreover, allergens like pollen, dust mites, and pet dander in the environment can act as triggers for some individuals, leading to allergic reactions and eczema outbreaks. Managing eczema often involves identifying and minimizing exposure to these environmental factors to help prevent or reduce the severity of flare-ups. Allergens. Allergens such as pollen, dust mites, pet dander, and certain foods can trigger eczema flare-ups in some individuals. Allergens are substances that can trigger or worsen eczema in individuals who are sensitive or allergic to them. Common allergens associated with eczema include pollen, dust mites, pet dander, and specific foods. When these allergens come into contact with the skin or are inhaled, they can lead to an immune response and skin inflammation in eczema-prone individuals. Identifying and avoiding these allergens is an essential part of eczema management. Allergen avoidance, along with appropriate skin care and medical treatments, can help reduce eczema symptoms and improve the quality of life for those affected by the condition. Skin barrier dysfunction. People with eczema often have a compromised skin barrier, which makes it easier for irritants and allergens to penetrate the skin and cause inflammation. Skin barrier dysfunction is a fundamental issue in eczema, also known as atopic dermatitis. In individuals with eczema, the skin's natural barrier, which normally protects against irritants and allergens, is compromised. This means that the skin is less effective at retaining moisture and blocking harmful substances from penetrating. In such cases, irritants and allergens can easily enter the skin, triggering inflammation and causing the hallmark symptoms of eczema, such as redness, itching, and rashes. Maintaining and repairing the skin barrier is a critical aspect of eczema management. Emollients and moisturizers, which help keep the skin hydrated, are often recommended to strengthen the skin barrier and reduce the risk of flare-ups. Stress, emotional stress and high stress levels can contribute to eczema flare-ups or make existing symptoms worse. Stress can significantly impact eczema, both by triggering flare-ups and exacerbating existing symptoms. Emotional stress and high stress levels can lead to the release of certain hormones and chemicals in the body, which can influence the immune system and increase inflammation. In individuals with eczema, this stress-induced inflammation can worsen skin irritation, itching, and redness. Furthermore, the itching and discomfort associated with eczema can themselves be stressors, creating a vicious cycle. Therefore, stress management techniques, such as relaxation exercises, mindfulness, and stress reduction strategies, are often recommended as part of eczema treatment to help improve overall well-being and minimize the impact of stress on the condition. Hormonal changes, hormonal fluctuations, such as those that occur during pregnancy or menstruation, can sometimes lead to eczema flare-ups. Hormonal changes can have a notable impact on eczema. Fluctuations in hormone levels, such as those occurring during pregnancy, menstruation, or menopause, can influence the severity of eczema symptoms. Some women may notice that their eczema worsens during these hormonal shifts. While the exact mechanisms are not fully understood, it is believed that hormones can affect the skin's barrier function and the immune response, making individuals more susceptible to eczema flare-ups. For those experiencing hormonal-related eczema changes, it's important to work with a healthcare provider to adjust their treatment plan accordingly, as hormone-related symptoms may require specific management strategies. Infections, skin infections, particularly with bacteria such as Staphylococcus aureus, can worsen eczema. Infections can complicate eczema, as the compromised skin barrier in individuals with the condition makes them more vulnerable to skin infections. Bacterial infections, particularly with Staphylococcus aureus, are a common concern for people with eczema. When the skin is already inflamed and scratched due to eczema, it provides an entry point for bacteria. These infections can worsen eczema symptoms, leading to increased redness, oozing, and pain. It's crucial for individuals with eczema to practice good hygiene, keep the affected skin clean, and promptly address any signs of infection, such as increased redness, swelling, or pus. In some cases, healthcare providers may prescribe antibiotics to treat bacterial skin infections associated with eczema. As for treatment, the goal of managing eczema is to reduce inflammation, relieve itching, and maintain the skin's barrier function. Now I told you about simple remedies for eczema. Such treatment approaches may include emollients, moisturizers, regular use of fragrance-free, hypoallergenic moisturizers helps to keep the skin hydrated and reduce dryness, which is a common trigger for eczema. Emollients, often referred to as moisturizers, are a fundamental component of eczema management. These products help to alleviate the dryness and itching associated with eczema by hydrating and softening the skin. Regular and consistent use of fragrance-free, hypoallergenic moisturizers is essential for individuals with eczema, as it aids in maintaining the skin's barrier function and reducing the risk of flare-ups. Moisturizers create a protective layer on the skin, preventing moisture loss and offering relief from the discomfort and itching caused by eczema. Topical steroids. These are anti-inflammatory creams or ointments prescribed by a healthcare professional. They can help reduce inflammation and itching during eczema flare-ups. Topical steroids are a common and effective treatment for eczema. These anti-inflammatory creams or ointments work by reducing skin inflammation, itching, and redness during eczema flare-ups. They come in various strengths and should be used under the guidance of a healthcare provider, who will recommend the appropriate potency and duration of treatment based on the severity of the condition. It's important to apply topical steroids as directed, usually in a thin layer to the affected areas, and to follow the prescribed treatment plan to avoid potential side effects like skin thinning. When used properly, topical steroids can provide significant relief and are a cornerstone of eczema management. Topical calcineurin inhibitors, non-steroidal medications that can be used for managing eczema, especially in sensitive areas like the face and neck. Topical calcineurin inhibitors are non-steroidal medications used in the treatment of eczema, particularly in sensitive areas like the face and neck. These agents work by suppressing the immune system's inflammatory response in the skin, reducing itching and inflammation. They are often prescribed when topical steroids may not be suitable or have potential side effects. Topical calcineurin inhibitors are considered a second-line treatment and can be particularly useful for managing chronic or recurrent eczema. They are applied directly to the affected skin, and, like topical steroids, should be used as directed by a healthcare provider to minimize potential risks and maximize their benefits in eczema management. Antihistamines, these may help reduce itching and discomfort, especially if itching is interfering with sleep. Avoiding triggers, identifying and avoiding triggers that worsen eczema, such as specific foods, irritants, and allergens. Wet wrap therapy, in more severe cases, wet wrap therapy can help hydrate and soothe the skin. This should be done under the guidance of a healthcare provider. Wet wrap therapy is an intensive and specialized treatment for eczema, primarily used in cases of moderate to severe symptoms. It involves applying damp bandages or clothing to moisturized skin, which helps to lock in moisture and provide relief from itching and inflammation. This therapy can be especially effective during eczema flare-ups, but it should be administered under the guidance of a healthcare professional to ensure it's done correctly and safely. Wet wrap therapy can be a valuable addition to an eczema management plan, offering rapid relief and improved skin condition. Prescription medications, in severe cases, a doctor may prescribe oral steroids, immunosuppressants, or other medications to control inflammation and itching. Biologic therapies, these newer treatments are sometimes used for severe eczema cases and work by targeting specific immune system pathways involved in eczema. Biologic therapies are a relatively newer class of medications used in the treatment of severe eczema that has not responded well to other treatments. These medications are typically administered by injection and work by targeting specific immune system pathways involved in eczema. By blocking these pathways, biologics help reduce the inflammation that causes eczema symptoms, such as redness and itching. Biologic therapies have shown promise in improving the quality of life for individuals with severe eczema, but they are usually reserved for cases where other treatments have proven ineffective or have intolerable side effects. They require careful monitoring and are prescribed by healthcare professionals who specialize in the management of complex skin conditions. Eczema is a chronic condition, and while it may not always be curable, proper management can help control symptoms and improve the quality of life. Thanks for watching. Please like my video and subscribe.